go to stratified squamous. As I mentioned before, stratified means multi-layers, more than one. And squamous means flattened. And epithelium. So this has three main divisions: stratified squamous keratinized, parakeratinized, or non-keratinized. So let's first start with the keratinized. So first, you can see it has many layers. So this is stratified. But now, how do you know it's squamous? We can see some cells here which look like cube shaped, they look cuboidal. But we always have to look at the apical surface. The apical surface, we see they're flattened. And these are the squamous cells. So this is stratified squamous cell. And keratina, this pink thing over here is keratina. So basically, keratina is a protein located in some surfaces of the body and majorly in the skin. So where we have keratinized, stratified squamous keratinized epithelium, they're located in epidermis of the skin. Majorly, stratified squamous epithelium are located in the areas with friction, and the amount of keratin depends on the amount of friction on the specific area. So now here, stratified squamous parakeratinized. Stratified squamous parakeratinized are all like the keratinized epithelium, but the difference is the keratin in those cells is much less than the one in keratinized. So it's half keratinized or partially keratinized. So these are some more than one layer, so they're layers, so it's stratified. Squamous, the apical cells are flattened and they have a bit of keratinization, so it's called parakeratinized. And these epithelium are located in masticatory part of the oral cavity, so where we deal with the food majorly in the dorsum of the tongue and in the pharynx when you go down. Now, stratified squamous epithelium non-keratinized. So as you can see, there are some layers, so it's not one layer, so it's stratified. They're flattened, the apical cells, so it's squamous, and non-keratinized. You don't see any keratinization here at the apical surface. So these kind of cells are located in the oral cavity, the vocal cords, the ectocervix, or the lower part of the cervix. And we have the upper part of the anus, the esophagus, in vagina, and the distal male urethra. So these ones are with very less friction. They deal with very little friction. So that's why they don't have keratin. They don't deal with food like the tongue. So they are in the lower part of the tongue. Now, stratified cuboidal epithelium. They're located in ducts of some glands, as like here you can see. So we know they are cuboidal. If you want to know if you're not very certain about if they are cuboidal or squamous or columnar, what you can do is look at the shape of the nuclei. If the shape of the nuclei is round, is like a circular, so these are cuboidal. If it's horizontal, that's squamous, and if it's vertical, that's majorly columnar. So now we can see majorly these ones are cuboid, like circular, and there are many layers. It's not only one layer. So even these ones are many layers, not only one layer. So it's stratified cuboidal epithelium. Now, stratified columnar epithelium. Stratified columnar epithelium, as you can see, we don't only have one layer, we have more than one layer. Here we have two layers actually. So they are stratified and they are tall, they are long. Look at the shape of the nuclei. Mostly they are vertical. So they are also located in ducts of some large gland and in the conjunctiva. Now, pseudo-stratified epithelium. As I said earlier, these cells they are multi-layered, but if we look closely, they're pseudo-stratified. They're not multi-layered. So this is only one layer, and this is not another layer. So one is coming from here and another from here. So they're pseudo-stratified. And now, for pseudo-stratified, we have some different types. As I mentioned before, cilia are finger-like projections, right over here. Finger-like projections on the apical surface of epithelium. And in this epithelium, you can see some special feature. So let's go with this again. Pseudo-stratified ciliated. We already saw the cilia. This is cilia, ciliated with goblet cells. So these white stuff that you see are goblet cells. These white ones, these big white cells that you see are goblet cells. So if they're ciliated with goblet cells, they're also called respiratory epithelium. So they're located in the respiratory tract, like bronchioles, larynx, airways, trachea. So these are called the respiratory epithelium. Now, if you go on this picture, the right side, they're also ciliated. We can see at the apical surface, it has cilia, finger-like projections. But it doesn't have goblet cells. There are no white goblet cells, and it's pseudo-stratified. So this epithelium is also called the olfactory epithelium. So it's located in the upper part of the nasal cavity, and olfaction means smelling. So they are actually for the sense of smell. So olfaction. And pseudo-stratified epithelium with stereocilia. These stereocilia, as I mentioned before, they're bundle and groups of cells closely packed to each other at the apical surface of epithelium, and we know they're pseudo-stratified. So they're pseudo-stratified, and they're basically located. They're very unique, only in the male genital tract, in epididymis, vas deferens, and ejaculatory duct. They're located only in these specific places, not anywhere else. So, and basically the major function of these stereocilia in these cells are to make the sperm move from in the male genital tract. And now here, the transitional epithelium or the urothelium. This is a very unique epithelium. So basically, if you have a look at this, this is now when it's relaxed, it looks like cuboidal, stratified cuboidal, because the apical surfaces are, the apical cells are, they look cuboidal. But if you see when it's stretched, they're like umbrella shaped, and sometimes they're binucleated, which means they have two nuclei in the apical cells. So in this picture, unfortunately, we don't have it, but normally you can see it somewhere there. So when it's stretched, the layers decrease. So you see here you have around 4 layers, but here you have like 2 to 3 layers. And they're located in the urogenital system, in the ureter, renal pelvis, urinary bladder, urethra, and the major and minor calyx in the kidneys. So in the urinary bladder especially, because when we have urine in our bladder, it stretches, so it can take place there. So now another complex stratified epithelium. So this epithelium at the apical surface, you see cells that you cannot identify what type of cells they are. They're very they're not similar at all to any other cells. So these cells, the other ones, which are not at the apical surface, they look cuboidal. But if you look at the cells at the apical surface, they don't have a specific shape. So these ones are called complex stratified epithelium, and they're very, very, very unique for the seminiferous tubules of the testes. So that's why they're also called the seminiferous epithelium.